So, just like a low back pain symptoms and what do they really mean, I'm going to talk about chronic neck pain and what really do they mean in terms of their location, where it's originating. So, basic cervical spine anatomy. So, cervical spine have seven vertebrae, C1 to C7, and from these nerve roots come out and travel into shoulders, arms, and hands. When disc bulge or arthritis develop, there is spinal stenosis. The nerve roots can be compressed, and each nerve root produces a predictable pattern of pain, numbness, tingling, weakness, weird sensation like cold, hot, crawling, and disturbed sensation called dysthesia. And so, depending on the nerve root, so let's start with the C5 nerve root, which is one of the most common one. C5 nerve root causes pain in neck, shoulder, and upper arm. It's going to be like that. Okay, so you're going to feel pain in the neck and the trap area and the upper arm. There may be numbness and weakness in the shoulder abduction. That means if you try to lift the arm upward, outward, you're going to feel weakness. And C6 nerve root, you have pain and tingling radiating into more biceps, forearms. So you're going to have biceps, forearm, and thumb and index finger. That's C6 nerve root. And so you're going to have some weakness in bending your elbows and wrist extension, like this movement. So you're trying to lift something, you're going to feel weak. And C7 nerve root is pain from neck down to the back of the arm. So when that pain is starting here, it's going to go to the back of the arm and into the middle finger. And that's middle finger. That's C7 nerve root. And you have weakness in the triceps muscle. These muscles here, triceps, gets weak. So you have a difficulty straightening your elbow and wrist flexion. C8 nerve root. So when you have pain and numbness into your ring finger and little finger, that's a C8 nerve root. And usually have a weakness in hand gripping and the finger flexion. T1 nerve root, less common. I'm adding thoracic one because C8 and T1, they are usually combined. It's less common but important, because what's going to happen that you're going to have a pain coming into the inner forearm, and it affects your intrinsic muscle. So you're going to have some weakness in spreading and closing your fingers because of intrinsic muscles movement. This is a part of the ulnar nerve which has both C8 and T1. So what happens when there's a facet joint and stenosis? Facet joint arthritis in the neck typically causes local pain. The pain will be in the neck area, and it does not radiate. You're going to have a stiffness, and it can come to your shoulder blade area, but never come down to your arm area. And you have cervical spinal stenosis, can cause both arms to feel heavy and numb and weak. And it's really worse when you're standing and walking around. So what you should notice, when the pain travels, you should notice whether it's a thumb, little finger, middle finger, because each means something different. Any numbness and tingling. Weakness in a special movement, like a lifting of the arm or bending of your elbow or gripping objects or spreading fingers. So chronic neck pain symptoms are not random. They're all roadmaps pointing us which nerve root is under pressure. So this is just a video for you to understand what these symptoms mean, because the more specifically you describe to your doctor or orthopedic surgeon, they would be able to make a determination easily on clinical basis. And of course, if they need to do more diagnostic studies, they will do it. So thank you for watching. I hope this is helpful.